To talk about a very interesting and relatively volatile topic, that is the management of massive APH. What are the steps, or what is the protocol for the management of massive hemorrhage, antepartum hemorrhage? Now, in any emergency, anybody who has studied in the medical school, has little bit of knowledge about management of emergencies, knows that ABC is always there. So we have added a little bit of twist to the ABC, and that will help us to remember the entire protocol for the management of massive antepartum hemorrhage. Now, first thing that we do when we see a patient with massive APH is that we see. First we have to see, and then we have to do. Now, what is it that we will see? We will see the ABC. So see, you are viewing the patient, and we are trying to assess how is the airway, how is the breathing, and evaluate how is the circulation. So the ABC rule is here, and you are firstly seeing, observing the airway, breathing, and evaluating the circulation. Next step in the protocol is when we start to do something with the patient. Now, it is common sense that when you know that the airway is all right and you have to help the patient with the breathing, it is through oxygen. So there's nothing that you have to learn about it. So the A and B, after you have seen the A and B, you have to do something about the A and B, and we have to give oxygen to the patient. Now, this table in the OT room, in the patient's room, with this plate and fork, is to represent the number 10. So what I'm trying to say is oxygen is served at the rate of 10 to 15 liters per minute. So this delicious table, this delicious plate with fork is to serve oxygen at the rate of 10 to 15 liters per minute. So this looks like the number 10, so I used the fork and plate to denote the number 10 liters per minute. Now we have to do something. After seeing the circulation, we have to do something about the circulation. And what is it that we are doing? We will put cannula. Now this is massive APH, so everything has to be massive. Patient has 2 hands, so we put 2 cannulas, and not any cannula. We put the orange cannula, which is the 14G cannula. So with the ABC, we have observed the patient, and we have done something with our observations. Okay, seen and done. Now this patient is like tired. Oh my God, you've assessed me. You have given me, served oxygen in a plate, and you have put 2 cannulas, and that to the thick ones, the 14G ones. Now give me some rest. So we will tell her, okay, you lie down in the left lateral position. She's pregnant after all. Okay. So this pregnant lady will lie down in the left lateral position, because we all know for pregnancy the preferred position is left lateral. Now, of course, she is in an emergency, so we have to make her very cozy. That is, we have to make the best arrangement possible to keep her as warm as possible. So you can make her lie down and you give her a blanket. Isn't it this much etiquette we all have? Now, after we've made her lie down in left lateral tilt, and we've made all the blankets and warm arrangements, now, of course, she wants food. You give food and sleep. This is what everybody wants. So now we have to give her something for her nourishment. Now, before we have the master is the blood. She's bleeding, so she needs blood. But before the master is there, we have to, before we have the main course, we have to give her the starters, isn't it? So before we have the main course, we will serve her hot starters. And see, this is a star kettle. That means the best equipment. She is bleeding. She is very VIP patient in the labor ward. So definitely we will give her the best equipment available so that the fluids can be rapidly warmed up, infusion fluids. Okay, so she's the VIP of the labor ward because she's bleeding, so we'll give her the best equipment for keeping her starter warm. And what is the starter that we will give her? See, we have two men standing together to form a heart. So this is a heart man solution. And why two men I'm saying? Because we can give it up to 2 liters. So 2 liters of Hartmann solution we can give her. And see, this fluid is coming in the shape of 1. So this also we can give 1 to 2 liter. The other colloids, we can also give 1 to 2 liters of colloid. And this Hartmann, up 2 men, so up to 2 liters of Hartmann solution, which is a crystalloid, we can give. This is a crystalloid Hartmann. Okay, so Hartmann up to 2, and the other fluid colloid 1 to 2. See, in the shape of 1 the water is falling. So before we have the main course, these are the 2 starters that we can give her. Normally fluid this combined can be given up to 3.5 liters preferably. Okay, so this is all that we have to do with her before we have the main course ready. Now she is a VIP patient. Of course we have to give her everything in full force. So these type of stupid filters, special filters, we will never use for her, because it will make the transfusion very slow, infusion very slow, and she's a VIP patient, so no filters, no special filters are to be used. First she will come, you give her a cozy bed, make it warm, give her the starters, the soups as starters. And what are the soups that we give her? It is the 2 men Hartmann and this fluid, that is the colloid, in the most special and the most best kettle possible. So this is the management protocol. And now we have the main course, so blood and blood products. As soon as they are available, now we will give her the main course in the next video. Till then, enjoy the starters. Bye.